Tummy tuck or lipo, how do I choose the right procedure for you? So when we think about the appearance of the trunk, like the belly or the waist or anything like that, there are a few things I always think about in every patient. Number one is the skin and the quality of the skin. Number two is the fat. Is there excess fat? And number three is the muscle. A lot of patients, especially women who've been pregnant or patients who've had significant weight loss, will have what's called a rectus diastasis. That's a weakening in the space in their abdominal muscles, and this may need to be corrected. So how do I choose between a tummy tuck, which is also called an abdominoplasty, and a liposuction if a patient presents for body contouring? Liposuction is a fat removal procedure, while an abdominoplasty or tummy tuck is designed to treat both fat as well as skin as well as the muscle. So with that in mind, that helps me decide what is the most appropriate procedure for a patient. So therefore, when I evaluate a patient with these procedures, I keep those things in mind. So if a patient presents a lot of loose or excess skin, or if a patient has the rectus diastasis, the muscle weakening, I would think that they're a better candidate for the tummy tuck. However, if a patient just has substantial fat but no loose or excess skin, then they're more appropriate for a liposuction. However, that being said, when I evaluate a patient for liposuction, one of the important things to evaluate is even if a patient doesn't have loose or excess skin, I also evaluate the quality of the skin. Because if a patient, if you think about it, let's say they're out to here and I take out their fat, you want the skin to redrape and retract really nice, kind of like a fitted garment. However, if a patient has what I call poor skin quality, they are more likely to develop loose skin or laxity. Now, anyone who has liposuction, there's always a risk of getting loose skin, but you want to minimize that as much as possible. And the way I can usually tell if a patient has poor skin quality is if they have what's called striae or stretch marks. That's the easiest way to tell if a person is at high risk for loose skin. So in these patients that have striae or stretch marks, I oftentimes will say to them, we can do liposuction, but you are at high risk for loose skin, so an excisional procedure like a tummy tuck may be appropriate. Now, if a patient presents with tons of loose or excess skin, as well as with an issue with their abdominal muscles that need to be repaired, then their pretty much go-to procedure is going to be the tummy tuck. Now you have patients though that are in the middle. Let's say a patient presents that has excess fat, they don't have any issues with their abdominal muscles, and then either they have a little bit of loose skin or their skin quality is okay, it's not great. Then what do we do in these cases? So in these cases, there's no perfect or clear-cut answer. It's really a patient-by-patient decision. So I first ask the patient, what are your goals? If the patient says to me, doc, I don't mind if I have a little bit of loose skin, I just don't want to do a tummy tuck. I say, okay, we can do liposuction, but there is definitely a risk of having loose skin, which may necessitate an excisional procedure later on, like a tummy tuck. If the patient says to me, doc, under no circumstances will I tolerate any loose skin whatsoever. I'm going to be really upset if I have any loose skin. I may say to them, okay, let's not even try the liposuction. Let's go ahead with the tummy tuck. So that's kind of my thought process for how I choose between procedures. And again, it's by patient, and it really needs to correlate with the patient's goals. If you have any questions or comments, you can comment below. You can DM me, or you can follow link in my profile